Hi, my name is Benjamin Grisky, and I'm here to tell you about COVID-19 risk in the United States based on population density. COVID-19 has impacted the world over the past year in many ways individuals did not think was possible. With over 120 million cases globally and 2.65 million deaths globally, the pandemic still continues to impact the health of individuals and the economy of countries. One of the areas impacted the most by the virus is the United States. The United States accounts for over 26.5 million cases and 535,000 deaths due to the global total. While COVID-19 has been raging on, one question in particular has yet to be addressed. How does population density affect the relative risk of individuals in the United States hospital system? Using Geospark analytics, Hyperion AI, we are able to investigate the risk COVID-19 poses on each county in the United States over the month of September in 2020. COVID-19, the COVID-19 risk model developed by Geospark Analytics' Hyperion AI displays the risk of each U.S. county poses on its corresponding hospital system. This data is displayed using gradual color symbology. Values 0 to 1 are counties which pose a low risk of COVID patient overflow to their corresponding county's hospital system. Values of 1 to 2 are counties posing a medium risk to their hospital systems, while a high risk county is designated by the values of 2 to 10. By using ArcGIS online operations dashboards, we can investigate a series of dashboards which display Geospark Analytics' COVID-19 risk model over the month of September in the year 2020. Each week, there is a designated month dashboard. Each week in the month has its own designated dashboard displaying its risk model for the corresponding week. By using operational dashboards, we can identify changes in COVID risk across the United States over the month of September in the year 2020. If we take a look at September 4th, we're able to use this dashboard, and it's an interactive dashboard. The link will be shared with you and attached to this presentation. But as it shows is we have a COVID risk, and it's separated by county in the U.S. right here. It is actually sorted from highest risk counties to lowest risk counties. And from here, we are able to do an analysis to generate hot and cold spots across the United States. During the week of September 4th in 2020, we were able to identify 3 different major hotspots across the United States. The first being in Southern California, containing the 2 major cities of Los Angeles and San Francisco. Additionally, we have a hotspot containing all of southern Texas from Houston south, and additionally most of the southeast United States, including North Carolina, South Carolina, Georgia, Tennessee, and parts of Alabama, is contained in a singular hotspot. This hotspot is designated by a high COVID risk score in a region across multiple counties. However, with that being said, we also are able to see that we have 3 major cold spots across the United States. This is designated by low COVID risk scores across counties in these particular regions. As we can tell that areas such as Colorado, Wyoming, up into Minnesota and Montana in the west and central regions have a very low COVID risk, while also we have Ohio, Michigan, Illinois, Maine, New Hampshire, and upstate New York, all contained in another cold spot. As we go to September 11th, we are able to, again, interact with this dashboard. This whole story map series will be provided. And while it loads, as we can tell, the highest risk areas have changed. So what we saw a lot of last week, during the week of September 4th, we saw a lot of areas such as Texas and in the south and western coast of California, South California, had been the highest risk areas. We were able to see that Illinois, Hawaii, Utah, scattered across the country, Virginia, there is areas that are ranging in high risk. So if we go to our hotspot analysis again, we are able to tell that the same cold spot in the central U.S. has actually shrunk down quite a bit. And then also on the northeast side, the cold spot containing Ohio, Pennsylvania, New York, New Hampshire, Vermont, and Maine has also shrunk down quite a bit more. With that being said, the hot spot in the southeast Atlantic United States has actually shrunk as well, with mostly Georgia, Florida, South Carolina, North Carolina, and parts of Southern Virginia showing in this hotspot. Additionally, a new hotspot has appeared in the area of western Colorado and into Nevada, right around Las Vegas. The hotspot around San Francisco and LA has also decreased a lot, so that's good news as well. Now we can go over to September 16th. During the week of September 16th, we see that the Southeast Atlantic hotspot is actually spread up into the Midwest, into Illinois, and parts of Michigan. With that being said, the cold spot in Ohio, Pennsylvania, West Virginia, upstate New York, New Hampshire, Vermont, and Maine has stayed static and actually has become a more solid cold spot. Additionally, we see that over in the western side of the United States, the hotspot around containing LA and San Francisco has also increased again, and COVID risk has gone up in that region once again. And then also the area of Nevada around Las Vegas has also become a more stronger hotspot. However, with that being said, we've also noticed that there is a new cold spot that is actually spread down into Texas and into Louisiana. The cold spot around Denver was here in the previous week, so that has stayed pretty static in the Midwest area of Wyoming and Colorado. However, now it's spreading down into northern Texas and Louisiana, which is really good to see. During the week of September 21st, the same cold spot that actually was in Ohio, Pennsylvania, West Virginia, Vermont, New York, Maine has stayed constant. That's a very good area for COVID risk. Over the course of the month of September, it stayed a relatively cold spot, which is this area has actually been one of the lowest risk areas in the entire United States over the course of the duration of COVID. Additionally, we see that the cold spot around Denver and in northern Texas and Louisiana has shrunk a little bit. However, it is still a strong cold spot for the most part. Additionally, we see that the hot spot in the southeast United States has shifted away from Illinois and has actually shifted more towards Missouri and Kansas, with the southeast Atlantic hotspot extending up into northern Virginia and into parts of Maryland and Delaware over here. On top of that, we are able to identify in the western United States the hotspot around Las Vegas is still there and strong. The hotspots around Los Angeles and San Francisco has shrunk a little bit, and there is a new hotspot in Montana. And lastly, we have the week of September 28th. The week of September 28th was a little bit weird. We had hotspots scattered across the United States. Even though they were smaller, they were in areas that they had mostly never been before. So areas such as Kansas and Missouri have really strong hotspots. Georgia has a really strong hotspot right outside of Atlanta. Central Florida is sitting strong in a hotspot. That's an area that's been uh, impacted by COVID-19 tremendously over the course of the past few months. And then, as we can see, we have new areas in Wisconsin and northern Minnesota, and yeah, it's then we also have a little small hotspot in Idaho. The coast of Virginia again is that hotspot extended from the southeast Atlantic all the way through Virginia, Northern Virginia into Maryland and Delaware. As we can see, the hotspot around San Francisco and LA is now gone. The South Texas hotspot is starting to reoccur. However, the Denver cold spot is starting to fade away, which is bad news. And then on top of that, we are able to see that the cold spot has gotten a little bit weaker in Vermont, Maine, New Hampshire, Ohio, upstate New York. However, it's still a cold spot, which is really good to see. And then if we go back to the population density of the United States, what we're able to see is that the United States has a very broken up population density, where the East Coast is the most populated right along the mid-Atlantic seaboard, and then Southern California. So as we're able to tell, some of the areas, especially up in the middle of the South and in Florida and in Los Angeles, had the longest duration and hotspots throughout the whole month of September. With that being said, I would still love to be working on this and proceed further in my analysis to determine the full impact of COVID risk based on population density. But I really enjoyed sharing what I've found with you, and I hope that you guys are able to like this dashboard and let me know if you have any questions. Thanks again for listening, and I hope to receive some questions from a few of you and talk with you further. Thank you. Bye.